red in there. Tell it's solid red.
Good morning, everyone. Welcome to the special Board of County Commissioners meeting for March 31st, 2020. If you would all please rise, join me in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We are doing this special meeting with phone lines open. If you would, please, could you identify anyone that is on the phone? Do we have anyone? Okay. I'm assuming that nobody has joined us by phone. Do we have any additions to the agenda?
I have none.
Okay, we will consider the agenda approved. Constituent time, once again, is there anybody on the phone that would like to speak? Hearing none, we'll move along. Under Commissioner Business, we have the COVID-19 update with Chris Stewart. Chris, the floor is yours.
Thank you, Commissioner Rover. I'll be trying to give you a brief overview of where the Emergency Operations Center is at with regard to response from COVID-19. Once again, we have Unified Command led by Roger LaValle, Karen O'Brien, and Jody Rover. From day one, the EOC and the county has been working as though COVID-19 is here and how to minimize its impact. That's our goal each and every day, is to act as though it's here and minimize its impact to the citizens of Delta County. We have a daily briefing every morning at 8 a.m. with representation from the healthcare agencies across the county, including the hospital, long-term care facilities, assisted living centers, public safety, each municipality, and other groups. Our biggest task and need is personal protective equipment for first responders and healthcare workers, as we do have a nationwide shortage of that. Our EOC team is working 6 days a week, at least 10 hours a day, to address needs for agencies and to be planning for our response to COVID. Some of the major accomplishments of the EOC: the hospital asked us to find an ozone sterilizing machine so we could reuse N95 masks for first responders and healthcare, and that machine was ordered. It is at the hospital and being tested by their lab so it can start cleaning N95 masks later this week. We have also ordered for them powered air purifying respirators for hospital physicians so that they can work in close contact with respiratory patients and do like intubations and stuff, and not put their staff at risk of contracting any illness. Those that have been ordered, they should be arriving later this week. They should be in Denver today. We're working on plans for hospital surge in cooperation with the hospital and health department and regional hospitals. We've also ordered hand sanitizer from a local company in Grand Junction. That will be coming in this week. And the EOC serves as a main coordination point and information sharing for all the agencies across Delta County. And we also work with the state EOC, DHSEM, and CDPHE with updates and regional coordination. We're also working right now actively the past 2 days and trying to find more COVID-19 test kits from various companies across the country. More and more of them are being approved by the FDA and CDC. However, we're not the only county in the United States looking for these tests, and we're not one of the hardest hit counties in Colorado or the United States, so they're prioritizing those test kits to those counties. So trying to get response from some of these counties is what's been a backlog for that, but we are actively working on that. We'd like to encourage all the citizens to don't hoard supplies and rush to the grocery store. Get only your essentials. Be prepared to be at home, but let the supply chains level out. more people bulk buy, the less there is for other people, especially people who have limited incomes or have been laid off, or the elderly. So take care and check in on your neighbors is what we're encouraging people. We've also established a joint information center, being led by Darnell Placewise of Delta County. She's the JIC coordinator, as well as PIOs from the city of Delta, Delta County Memorial Hospital, and other entities across the county. We did launch a new Facebook page specific to COVID-19. It's facebook.com/Delta County COVID-19. Information will be shared on that, as well as our normal pages. As part of that, they've also launched a Delta County Resilient campaign on social media, so be sure to follow that. And this Thursday and Friday, we will be doing a Stuff the Bus campaign at the Delta Walmart and Hotchkiss City Market to gather any personal protective equipment that people may have and cleaning supplies for first responders and healthcare workers. More information will be shared today and tomorrow on that. And also there will be a town hall type roundtable videoed and posted to social media on Thursday with medical experts and the incident commanders of this response. The EOC has 103 volunteers at today's count, helping between the call center, sewing masks, building face shields, moving supplies and inventorying supplies, and delivering meals for shut-ins and volunteers of America. The call center has been receiving an average of 25 calls per day, with 7 COVID screenings on average per day. And that's open Monday through Saturday, 8 a.m. to 6 p.m. Saturdays are typically our slowest day, though. We received a request for 1,500 gowns from the hospital to be sewn, so we have volunteers actively ready to start making those gowns. We're just rounding up the last bit of supplies for those gowns today, as well as contacting some companies that are repurposing, they make other supplies, but they've been repurposing their factories to make gowns for healthcare. So we're working with them to get pricing and see if we can purchase from them as well. We also want to thank all of our dentists, massage therapists, tattoo clinics, and vet clinics who, when we put the ask out last week, donated boxes of gloves, surgical masks, some N95s, and cleaning supplies. That's been a big help to be able to get some type of supplies out to first responders that didn't really have anything. We also learned yesterday that Westlock Mine has donated 200 Tyvek suits to first responders and healthcare workers. So once we get those, we will begin distributing those, which that's a big thing because they can be disinfected and reused and are not single-use disposable type. The health department and EOC received medical supplies such as N95 masks from the Strategic National Stockpile and the Western Slope CDPHE medical cache. And those supplies back on March 13th went to Delta County Memorial Hospital. They've also been given to the Delta County Jail. A second shipment to the hospital, as well as PACE, Horizons Healthcare up in Eckerd, Willow Tree Care Center, Surface Creek, and the Pawnee Care Center, and again to the Delta County Jail and the coroner's office. Our greatest needs are still gowns, face shields, N95 masks, booties, and such. And our volunteers are doing a great job of making face shields out of elastic and foam. So, the last count, we still only have 1 case here in Delta County, but let's not focus on the case. Let's focus on the fact that and act as though it is here, because Mesa County, as of this morning, has 12 cases, and Montrose has 14 confirmed cases, so it's all around us. And Gunnison is also one of the highest number of cases around. So that's a quick summary of where we're at for COVID-19. Is there any questions I can answer for the commissioners?
You have any questions?
No, I just, I think, once again, kudos to you guys and the crew and all the county staff that, really stepped up on this thing. 103 volunteers, that's just amazing. So,
Got to give a hand out to all those folks that are working so hard to keep this thing, and just try to remind everybody, just be patient. We're doing what we can. I know people are getting anxious out there, and they're starting to get a little bit of cabin fever, but we're doing what we can, and it'll be over soon enough.
Self-isolation is what's going to prevent the spread any further, so we can get back to our normal lives. And thank you to Robbie and Karen for their leadership as incident commanders throughout this. Jody Rover at the hospital as well, as we continue to work long days and work through this.
Any cases in San Miguel?
Last count last night, they still show one for San Miguel County.
Okay. Thanks again for all your hard work. And thanks to all the volunteers. Kind of neat that we have that many people available that will self-isolate but still come out and volunteer.
And when they're doing as much as they can from their home. If they do have to come out, we're making what PPE we have available for them so they're not unnecessarily exposed and stuff, and encouraging them to follow the governor's order and only travel when absolutely necessary to get supplies and stuff as well too, so.
Well, I want to personally thank Chris, because I know the hours he's put in have been a lot. So thank you for all the time, and writing the report every day is in itself a job, and I appreciate that. Our EOC is impressive. I am very proud of what Delta County has done with this process. We're awaiting the storm, but as of now, it hasn't come.
Right.
And hopefully it doesn't come. But I think we are as prepared, probably more prepared than the majority of the United States, and we've been lucky, because we've had the time to prepare. But I'm very proud of our EOC and our incident commanders and the volunteers. It just shows that this county is willing to take care of itself. And when it comes down to it, we may have to, because we are a small fish in a big pond here. And with what's going on both coasts, I mean, we can be overlooked very, very easily. And but we are set up to take care of ourselves. I firmly believe that. And once again, thank you to all of the members of the EOC that have put in time and continue to put in the time and effort that it takes. But I especially thank you for your coordination, guys.
You're welcome. Thank you guys for your support. Robbie and Karen, and the health department's not working in the EOC because we're following social distancing guidelines, but Karen has a whole team at the health department that's put in many long hours too, so
Yeah.
I'll make sure that's.
Yeah, and once again, for the general public, I think it's a personal responsibility to maintain the social distancing and stay at home if you don't need to be out. So with that, I make that plea out to the personal public to, let's try and minimize this as much as possible.
Great.
Thank you, Chris.
You're welcome. Thank you.
Okay, we'll move along with our agenda then. We've got consideration of the board to award a bid for the 2019 RFP 29 architect drawing of courthouse remodel. Commissioner Supas, I think you have the lead on this.
Yes, we brought this to you guys when they first submitted the RFP. The number was quite outside of our budgeted amount. So with permission of the board, I sat down and worked on negotiating a better price. Conveniently, we also found some 1956 prints for this building in that period of time, which helped with that. They answered a lot of questions that they were concerned about. We also had discussions about some of the stuff that they had figured into their bid, that were not necessary. And so we've got that dollar amount now down to $79,330. We had budgeted $80,000 for design of this project. We do have a grant from underfunded courthouse for this for $37,500. So, you know, with that being said, I think Blythe Group is the one that gave us the single proposal, and they have adjusted their numbers, and I think that we can get a good quality product out of them, and they've got a pretty good timeline here. We kind of need to get pushing on this though, because we really need to have this design done by August so we can get into that next grant cycle for actual construction dollars on this. The underfunded is pretty good about funding something if they've got good design work already, and I'd like to be able to make sure we get that done. So that's kind of the reason I brought it up now versus waiting for a few weeks, is so we could get started sooner rather than later and get it up into that next funding cycle. So right now they're looking at about a total design duration of about 12 weeks. And this will give us construction-ready prints so we can basically hit the ground running.
Questions or comments?
Thanks for getting them negotiated the price down. That's great. That's great.
Yeah. I'm waiting for your TV commercial about strong arm.
Well, we just had a few things that weren't clear, and we got it straightened out, and everything's should be good. So.
Well, I move the award the bid for 2019 RFP-29, the architect drawing of courthouse remodel to the Blythe Group in the amount of $79,330.
I'll second that motion.
Have a motion and a second on the floor. Is there any further discussion? Hearing none, all in favor signify by aye.
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 Aye. So done.
Very good.
So next we have a consideration of bid for the audio video for the Human Service Building.
So we had two bids submitted, one from AV Experts and one from All Sounds Designs. The AV Expert bid came in at $24,709. The All Sound Design came in at $16,863. John Latta, our IT director, has reviewed both bids and actually walked through the Human Services Building several times. His recommendation is to go with AV Experts, and although that is the higher bid, their bid was more compatible with our existing equipment, and he feels that would create less issues down the road. That is his recommendation. That would still fall within line with our total budget for the Human Services Building.
Part of this cost, it's actually spread out throughout the Human Services Building, but one of the bigger costs in there is the audio video for the Rubidoux room, the meeting room with the big screen, projector, and that was pretty expensive equipment for that section. Other parts of this are stuff that TVs and things that are going to go in the interview rooms, some of the public areas, and part of that is stuff that Chuck has a grant for from the state that will help pay for some of that. So, but the bulk of it is for the Rubidoux room and our large meeting room over there. So.
Any questions?
No. Well, I move that we award the bid to AV Experts for the audio video for the Human Services Building in the amount of $24,709.
Second the motion.
Got a motion and a second. Is there any further discussion? I might just say that this sounds like it is kind of, you get what you pay for.
Well, that was the discussion we've had. AV experts are the ones that currently do our audio video stuff. They've been pretty responsive to Terry when she's had issues. They focus more on the commercial side. The other company, they're more of a residential, a high-end residential company, so I think that was part of the reason John felt more comfortable with AV experts, so.
I think John's recommendation is worth quite a bit. So.
Well, he's the one that's gonna have to deal with it when things aren't working, so.
Any further discussion? Hearing none, all in favor of said motion signify by aye.
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 Aye, so done. Do we have any further business to come before the board?
I have none.
We'll consider ourselves adjourned then.